Health Organization, the physical and social environments are key determinants of whether people can remain healthy, independent, and autonomous long into their old age. So beyond economic benefits, age-friendly environments are also a mean to ensure that the rights of elderly people are protected regardless of their age and abilities. Moreover, age-friendly environments benefit not only older persons, but all generations. For example, better accessibility of outdoor spaces and transportation, of course, which is very important for families who are with wheelchairs. Environments, as we all know, they do play a very important role in determining our physical and mental capacity across person's life course and into older age. Also, we adjust to loss of function and other forms of adversity that we may experience at different stages of life, and in particular in later years. So both older people and the environments in which they live, we all know, are diverse, dynamic, and changing. In interaction with each other, they hold incredible potential for enabling or constraining healthy aging. From societal to medical requirements, elderly people, we all know, rely on assistance and public policy that can protect their interests. Welcome, everybody. I'm Pratima Penumarthi, founder and director of Arya Math Academy online tutoring program. Our academy, we all know that in collaboration with Stravio, we proudly present STEM Talks. In this talk show, we will introduce you to fascinating people who very passionately inhibit scientific and technical frontiers of our society. It's with tremendous pleasure that I welcome you all to our 4th episode of Arya Math Academy's STEM Talks. Today's STEM Talk is with Dr. Nidhi Gupta, who is a social gerontologist and a public health expert. Given her doctorate in the field of aging and post-graduation in the field of public health, she has a unique blend of pure and social sciences. She's currently working with the Department of International Health, Johns Hopkins University, as a senior researcher on a health systems strengthening project in India. Dr. Nidhi, along with many other achievements, she was invited to represent India and even deliver keynote address of, I think, plenary session of age-friendly environments at the Inter-ministerial Conference of Health Aging. Her research interest includes aging and health, quality of life, feminization of aging, health and social care models for elderly, age-friendly environments, health system strengthening, and public health and management capacity development. Lot about Dr. Nidhi. So Dr. Nidhi Gupta, welcome to our show.
Thanks a lot, Fatima. Thanks for having me here.
Thanks for being here, Dr. Nidhi Gupta. The very first question, which will be, of course, I know a little bit about it, and of course, you will talk a lot, but I need our viewers to know more exactly what is gerontology.
Actually, this is a very important question that we need to raise awareness on, because as soon as we start talking about aging, the first thing that comes to mind is geriatrics. That's more popular. However, gerontology is a more comprehensive term and a discipline which is multidisciplinary, which incorporates the social, economic, cultural, behavioral, and various other aspects of aging, and it definitely does include the health aspects of aging too. So geriatrics at one end clearly deals with the diagnosis and the treatment of the diseases that emerge as people age. Gerontology is a more holistic discipline, or I would say, which incorporates various other dimensions of aging that enable people to have a healthy life and have a quality of life.
I see. And Dr. Gupta, is it true that in developing countries, elders are aging rapidly?
Yes, you're right. Elderly are aging rapidly in the developing countries. though in the early 80s, it was considered as aging was considered as a phenomenon which was occurring in developed countries, which was true at that point in time. However, now with the current projections, by 2050, there will be about 2 billion senior citizens around the globe, and more than 80% of them would be living in developing countries. To give you an example, today India has about 100 million senior citizens, which are going to triple by 2050 to over 326 million, which is almost equal to the total population of the United States currently. So that is the quantum of older people that would be living in developing countries. And another important aspect of it is that the pace at which the aging is taking place in the developing countries. If we look at the speed of aging, the developed countries took about 150 years to double their older population from 10% to 20%. And if you look at the same phenomena in developing countries, they are taking less than a little over probably 20 years to double their older population. So they are getting very less time to really prepare for the changes, the demographic changes that are going to happen in their population, and the consequential implications of having a larger cohort of older persons in the population.
I see. And also this population aging and increasing longevity, their necessity, necessitating basically an examination of the skills and training needs of our healthcare professionals and the capacity of our healthcare services and systems. I do believe, the researchers believe that the adoption of the life course as a conceptual framework will assist in developing efficient and equitable responses to this challenge. So could you, explain to our viewers the life course approach to healthy aging?
Sure. Actually, the life course approach provides a sustainable solution to ensuring a healthy life as well as quality of life as people age. So what life course framework advocates is that the rate of decline of the functional capacity is largely determined by the factors like the lifestyle that a person has had over the early life or adult life or the older ages. In addition to that, various external factors like the external, social, environmental, and economic factors also determine the functional capacity of an individual. So if a person has had opportunities to maintain a healthy lifestyle, an active lifestyle over the life course, a person tends to have a better quality of life as they age. So there is a need to adopt a life course perspective in the policy as well as all the interventions that we are thinking, and not just think of what do we do for the cohort that is already into an older population age group. Instead, a life course perspective provides a sustainable solution for developing policies and interventions that could lead to better health outcomes.
I see. So, what is a safe environment for elderly?
When we talk of safe environment for elderly, any environment that fosters health and well-being and enables participation of people as they age is considered as a safe environment or an age-friendly environment. And these kind of environments are usually, provide accessible, equitable, they're inclusive, they're safe and secure and supportive. Mm-hmm. So if an environment meets these kind of criteria, we can say that, these are safe environments that promote health and prevent or delay the onset of disease and functional decline in an individual. So they are beneficial for all age groups.
Okay. And Dr. Gupta, are there any global initiatives to promote active aging through age-friendly environments?
Yes. So as I mentioned that, there was a recognition that the population is aging, and there are, and it was considered to be a phenomena primarily of the developed countries. So all these interventions began quite early in the 1980s, when there were, various, World Health Assembly and World Aging Assembly, and more specifically in 2002, when there was the Madrid International Plan of Action on Aging, MIPA. It's usually referred to as MIPA, which clearly spoke about building a society for all age groups. And it highlighted the need to focus on three priority areas: older persons and development, the advancing health and well-being into old age, and most importantly, enabling and supportive environments. So this was the most important landmark global policy initiative, which spoke about the need for focusing on enabling and supporting environments. And it clearly highlighted that it is the responsibility of individuals to stay healthy by adopting a healthy lifestyle. At the same time, it is the responsibility of the government to create a supportive environment that enables the advancement of health and well-being as people age. So that is one of the landmark global initiative, I would say. In addition to that, there have been various initiatives by the World Health Organization in terms of developing an active aging framework, which talks about providing individuals with the opportunity to continue participation in community, to maintain health as they age, and provide a safe and secure environment. Similarly, there is another initiative by WHO recently, which talks about, which has declared this decade as a healthy aging decade, 2020 to 2030. So there have been various such initiatives to encourage nations to take up these frameworks and fine-tune their policies to prioritize aging issues, in addition to the other challenges that are specific to their local context.
Okay. So my next question is, what are the key environments that are needed for healthy aging? And also the second part of my question is, how do we create AFAs or age-friendly environments?
I think this is a very important question when we have to, how do we go about translating this knowledge about age-friendly environments? How do we conceptualize an age-friendly environment? And what could be considered an age-friendly environment? So on a very superficial level, whenever we talk of an age-friendly environment, we can visualize that an environment, a physical infrastructure that is more accessible and more supportive of all ages may be considered as an age-friendly environment, which is true, but it is not just limited to the physical infrastructure that we are talking about. The key environments that play a vital role include our home environment, how our neighborhoods are designed. That is a vital component. How our communities are designed structurally as well as socially, how they are organized, and the social relationships that are there to make sure that the person continues to be socially connected and not isolated as they age, or given the functional decline as people age, they are not socially isolated. So, and these environments, as we can see, when we define them more holistically, they are dynamic, they are diverse, and they are ever changing. That is why there is a need for constant research to ensure that we are making a policy and intervention which is context specific, which continues to maintain its relevance as the context evolves with changing times. So this is what entails the key environments and how we can create age-friendly environments. Again, the answer lies in the key environments that we have defined. So if we're talking about the interventions, we need to define it at and conceptualize it at different levels. For example, we need to think of interventions which are at the individual level, definitely. However, the interventions which are at the family level or the community level or the national level play a more vital role in ensuring that the interventions at the individual level are minimalistic because they are more resource intensive. Hence, as we go above the continuum, the impact of the interventions is more. And as we go down to the individual level, the impact is only at the individual, and that becomes resource intensive, which may not be an ideal way to move forward for even the developed countries, I would say, more so for the developing countries.
Okay, yeah. And it is a little bit more to grasp it, but it is very interesting when you were talking about all this. Dr. Nidhi Gupta, how does World Health Organization, it raise awareness on the importance of environments in determining healthy aging and encouraging the creation of age-friendly environments?
The World Health Organization, as I earlier mentioned, have come up with various kinds of initiatives, from declaring this decade as the decade of healthy aging to taking initiatives which are specific to creating, environments for age, which are age friendly. World Health Organization had come up with an initiative of creating age friendly cities, which is, which is spread across all the continents, and many countries from around the globe have taken up that initiative to develop their cities, picked up a few cities, and then develop them as age-friendly cities. And when we say age-friendly cities, they are focusing on 8 main dimensions of creating an environment which creates an age-friendly environment. And these include social participation, respect and social inclusion, ensuring civic participation and employment of senior citizens, ensuring housing which is age-friendly, ensuring that the transportation that is there is more accessible to all age groups, ensuring that the outdoor spaces and the public spaces that are there are more, age-friendly and are accessible, especially to the senior citizens. There are other initiatives like organizing community support and health services within the communities to ensure that older people as well as people from all age groups are able to access those services. And also, as with all these technological advancements, ensuring that the communication and information is available to all age groups in the forms that those age groups are able to understand. So these are the 8 main initiatives, broad areas of initiatives under which the cities are being developed as age-friendly cities. And I'm happy to note that there are countries from the developing countries, countries from the Southeast Asian regions also, who are participating into these initiatives and trying to create their cities which are more age-friendly.
That's really interesting. Yeah. My next question is, could you actually, for the viewers, could you provide some examples of models to improve quality of life of older persons from, of course, because you're based now in India, so, with respect to from India, like, the models to improve quality of life of older people from India?
Sure. I would say India is testing a lot of models across various dimensions to improve the quality of life of elderly, be it health, be it nutrition, be it housing. Different states in the country are trying to experiment different models based on their local context. In India, aging is taking place in a very I would say different manner, because the different states in the country are at different levels of demographic transition. The southern states are demographically more advanced than the central and the northern states. So most of the models are being tried, especially in the southern states of the country, where there are more which is more demographically advanced, where the proportion of older persons is more as compared to the other states. So some of the models, like one of the states of southern India, which is Tamil Nadu, has experimented a model called integrated housing complex, in which they have created a home in different parts of the state, which provides housing to both children as well as senior citizens together, and it is made for women, especially to ensure food, shelter, medical care, and recreational facilities for both different kinds of age groups. This ensures intergenerational bonding because children are living there and senior citizens are there, so they can bond with each other, provide social support to each other. Seniors have the experience; they can take care of the children as they age, and children with their energy and enthusiasm enable the seniors to stay socially active as well as feel emotionally connected. So this is one model, interesting model that has been tried. Similarly, HelpAge India is doing a lot of work in ensuring accessible healthcare by creating mobile medical units, which are usually located and which are run in the remote areas of the country, so that there is medical care which is accessible in the rural areas where the elderly can access that care at their doorstep. Similarly, some of the models are, in India, there is a scheme of midday meals to ensure nutrition for children. And some of the states have very interestingly clubbed the scheme for senior citizens as well to ensure nutritious food for senior citizens within the community, because some of the senior citizens do not have the ability to cook their own meals. So they also get to have the meals with the children. So which has, again, a spectrum of benefits where senior citizens can ensure, the quality control on the food, which children may not be able to understand. It ensures nutrition for both senior citizens and children, and it promotes intergenerational bonding because they all sit together and have food. It also ensures social connectedness of the seniors because they go to the same place as children, so they walk a few, they walk for a few distance, and then they meet at a place. So while they journey to the Anganwadi centers where they are served the meals, they get to meet people, they get to connect to each other as well as connect with the community. So and there is dignity that they are doing the quality control for ensuring nutritious meals. So there are a whole variety of models being tested. I'm sure there are many more models being tested in different countries, more so especially in ensuring health of the people. But I believe that these kind of social initiatives which ensures social connectedness, ensures nutrition, are some of the initiatives that can promote a healthy aging in a much broader sense by adding quality of life to their lives.
Absolutely. Absolutely. Whatever you said is wonderful. And I'm very happy to see, like, India is doing great, compared to when it comes to all this, opportunities that has been given to the elders. But what, according to you, Dr. Nidhi, are the challenges along with opportunities, to creating age-friendly environments, especially in developing countries?
Yes, I think this is a big question because the priorities of the countries need to change a little to accommodate the aging issues that are emerging with the changing demographic profile of the population. So it comes with challenges, but it does come with a window of opportunity as well. So I would say the biggest challenge and the biggest opportunity is the political will. Once we have the political will to address these issues, an acknowledgement that we need to prioritize aging issues, I think more than half the battle is won, because once there is an awareness at that level, that will indeed spread an awareness till the grassroots level to ensure that there is sufficient importance given to aging issues, awareness within the community about the aging issues. With the political will, the second important challenge is resources, which are always limited, especially in the developing countries. But yes, the developed countries are also facing this challenge because initially most of the aged care was individual centric, which is more resource intensive. So resource allocation is another important challenge. And with it is a very closely knit concept of efficient utilization of the allocated resources. So we need to ensure that the resources, whatever resources are allocated for ensuring, for addressing the aging issues, is utilized in the most efficient manner. Another opportunity that I see is public-private partnerships, because the public sector in itself may not have the sufficient capacity and the resources to address aging issues. And public-private partnerships provide a very big opportunity to ensure that both the government and the private sector pool in their resources and work hand in hand to address the aging issues. So PPP models, either by engaging corporate sector or utilizing the corporate social responsibility to address aging issues, could be some of the models to address them. One of the biggest challenge that I see at the community level is ageism, that is discrimination based on age. And this is everywhere in some or the other form, be it developed countries, be it developing countries. So it is, we really need to address ageism in a very context-specific manner, understand the cultural implications of aging in every context, and then sensitize people, and so that this kind of age-based discrimination could be removed from the mindsets of the people. And all of this could happen only if we see more seniors, more older persons participate in all these activities, in all these decision making. So once we have role models around us in all domains, all walks of life, I think we can really combat ageism in a very, pragmatic manner. So these are some of the challenges that I can think of, and some of the opportunities that we can bank on to address the aging issues.
No, it's absolutely wonderful. Thanks for giving us so many examples. This is a question which you already mentioned right in the beginning, but I would want the young viewers, the youngsters, to understand this difference more clearly. Could you please again explain the difference between gerontology versus geriatrics?
Sure. I think it's really important for people to understand this difference. So to make it more simplistic, you can see geriatrics as something which is more adhering to the biomedical model of understanding a disease, a biomedical model of looking at an individual, that if there is a disease, we need to treat it. So geriatrics primarily takes care of the diagnosis and treatment of age-related diseases, whereas gerontology is everything in addition to geriatrics that he said. So it looks at a person as a whole. So the social integration of a person, the economic aspects of aging, the behavioral components. So all of that encompass the gerontology discipline. And we say that it is multidisciplinary because there is space for everybody to contribute, be it a fashion designer, be it an architect, be it a researcher, be it a doctor in preventive health. So we can have a lot of examples of how you can go about contributing to gerontology and, supporting, in the discipline of social gerontology.
Absolutely. Thank you very much for telling us this difference. Also, now this is my perspective. You see, the need for persons, to work with older adults will not be adequately met, if students, they leave high school or they leave college with little or no understanding of aging. And perhaps of greater concern is that much of what is communicated to society about aging and older adults is negative and also misinformed. I personally feel on my part, Dr. Gupta, is that government needs in whichever country, whether it is developing or already developed countries like US, needs to infuse gerontology into high school social studies curricula. What do you say about this?
I think that is the best way to address it, because today the person who is a child is going to is aging at with every breath that they are taking. They need to be sensitive to the context in which they are living, the people around them, and that can happen the best once we integrate this thing into the education system in terms of creating sensitivity to that, ensuring that they understand the challenges that arise with the changing population that we see, and also start thinking creatively of it as something which is which comes naturally to them, instead of seeing it as a segregated piece of work. If they integrate it, because people are a part of society, once you start seeing them as included within the society, then this acknowledgement of creative ways of ensuring that we are thinking of this important section of the society as well will emerge from within. Yeah,
that's true. Very true. Also, degree in gerontology from from certain universities, this opens so many doors. And I know that they have degree programs in the world. So many are having this hands-on training from some of the universities. They're having hands-on training from international renowned professors. Co-vetted internships are getting. Also, the kids are getting connections to make sure, making sure the graduates, they graduate, are sought after, by a variety of industries. So what, according to you, are the infinite career choices in gerontology field?
Gerontology provides, as you said, infinite career choices, I would say. There may not be a formal acknowledgement of different dimensions of it yet, but yes, in the times to come, that has to happen. That would come on its own. So there is a formal acknowledgement of having a lot of research in the field of gerontology. So we have, various higher degree programs to understand the aging issue. In addition, there are many universities which are offering various, vocational courses or short-term courses to specialize in certain segments of it. For example, as I mentioned that, even if you are a fashion designer, you could contribute to aging issues. I've known people who are into fashion designing, and because they had seniors at home, they found that, they are facing challenges and difficulty in dressing up every day because the kind of clothes that they are wearing is not age friendly. So they tried to make designs for clothing which looks as if they're wearing the same old sari as in the Indian context, but it is so easy to wear that even if they have a frozen shoulder or if they have any other challenges, it's very easy for them to wear it. So that is another concentration that a person who's getting trained in fashion designing can undertake, though it is not formally being acknowledged at this point in time in many countries yet. But yes, some of the colleges have started experimenting with these kind of things. Similarly, there are opportunities for creating architecture, the infrastructure in a way which is age friendly. So there are specializations in architecture as well, which are being experimented by various universities across the globe to ensure that these kind of issues are also addressed. In technology, in mobile technology, or digital social networking platforms is another area where, you can make your career if you are more technologically bent. So to ensure that, the devices that are being created, the hardwares that are being created, as well as the softwares that are being created are age friendly. So you are not leaving behind anybody as you advance into the technology. So ensuring that we take, everybody along with us as we move at a different level in technology. So students can see those kind of careers. Similarly, a big pool of people working in the field of aging come from social work, who actually make social work as their primary goal, and they try to work with seniors at different levels within the community, be it within the facilities or the nursing care homes. Similarly, nurses who are specially trained in the field of aging, geriatrics, as well as the social aspects of aging, is another area which the students can look at. So you can imagine any kind of area, and you can make space for yourself if you have that passion to work for seniors. I have seen a few spas these days which are catering to people of age, all age groups, especially nursing homes that require, provide some saloon services for giving a good pedicure to, somebody who's very old. So the kind of services that will be required, you need to be sensitive towards the issues that a person of that age may be encompassing. So there are the whole the spectrum of services that you can contribute to, a whole lot of opportunities for people who want to contribute to address aging issues. So you need not pick aging as per se as your career choice. You can pursue the different dimensions that you're doing, but if you have a passion to work for elderly, then you can pick up that passion and contribute in your own way to this field.
Absolutely. And actually, just adding to what you said, Dr. Gupta, is that this is for all undergrads. Those who are interested in the top jobs in that profession and want to earn a master's degree as one of the requirement. I think that's why even universities have added up now in US here, many degree programs which is targeted at this particular specific field. A lot of students now learn about working, as even Dr. Gupta was mentioning, in variety of areas within aging services. And these include both long-term and short-term care, as well as overseeing service-protected, service-supported housing, community service organizations, health services for elderly, and I think the techniques for marketing to the aging population. There's so many things which is going on around. So Dr. Gupta, here, could you give any advice to our young audiences, the graduates, undergrads here, especially even high schoolers, that you would like to share?
The only thing I would like to say is do something in your life which brings, which addresses the community that you are living in your own way. Do not try to follow the path of XYZ person, because each individual is creative in their own sense. And what you can bring to the society is something that you only know. But to do that, you need to engage with your own self, set your priorities right, and make your own path. That's how we bring in diversity in this world that we are living. And you are the change makers of this time, I would say. So just understand the power that you have and bring that change, not just in your life, but the lives of the people, the society, the community that you're living in as a whole. And you can do it. And there are so many interesting career opportunities coming up, so many different ways to get sensitized to it. So use the best way, to try to use the technology in the best way, not to isolate yourself, but to integrate yourself within the society and bring about a change.
Thank you so much, Dr. Gupta. And I feel short of words for, thanking you and giving us so much of information regarding gerontology and especially to the youngsters. I want to end this show by just saying that investing in age-friendly environments, it helps all of us to focus on prevention and empower people to live independently for longer, and also which lowers the pressure that is put on family caregivers, former care facilities, also on public budgets. Elderly population, because we're all concerned now, and it's very closely knitted with every single person. So elderly population, they themselves would love to interact with the built environment in ways that reflect changing lifestyles and changing the physical capabilities. So promoting age-friendly environments like whatever today Dr. Gupta was explaining, AFE is one of the most effective approach for responding to demographic aging and increasing the healthy life year indicator. I hope everyone enjoyed the show today, and hopefully the viewers will get more questions. And if you get any such questions or anything related to gerontology, please feel free to write under the comments in our YouTube channel and talk about it. Please share this so that a lot of people who are concerned about their caregiving jobs, or also need to get more information about elderly care, that'll be very, very helpful. So tune into our show. And if you like, please do write a review of the STEM Talk on your YouTube channel. Okay, and please don't forget to subscribe. Thank you very much, and spread the word.